everyone to another wonderful episode here at Jaws Podiatry. It's been almost a year. We're 20 days away since this all started, right, Caesar? The whole mask thing. Unbelievable. Nonetheless, we have a young patient who has presented to our office for the first time today. Patient does have some minor issues. Patient does battle Parkinson's disease as well as multiple sclerosis. My sister has MS as well. And, you know, we were just talking at the core, aside from that, patient had previous ankle surgery. Patient is possibly having bilateral knee surgery in the near future. There's a lot of osseous derangement. That means is that, you know, from a biomechanical standpoint, the patient is walking completely, totally different, all over the place. And, you know, because of that, the patient has developed these massive volcano-like corns on the bottom of both feet. 2 on the left, 1 on the right. You know, at the core, there is an there's an underlying structural problem, okay? And the symptom is the callus, the corn and or the IPK, the intractable porokeratosis. So, you know, we were talking as well that, as everyone knows, we do a lot of minimally invasive surgery to correct some of these structural deformities in order to eliminate these symptoms, which can affect everyone's daily life activities. So we're gonna go ahead today, you know, the Band-Aid, we're gonna go ahead and really, you know, enucleate. I know everyone likes that word, enucleate the corn, callus and or IPK, intractable porokeratosis. Let's get to work. Just looking at them hurts. One eye, we should just draw like a little nose and a nice happy face there. We do have a sense of humor. Anyway, so we already applied the Tri-Soft. Okay, and we're gonna go ahead and slowly just start carving away. You know, people don't really understand how painful these lesions are. Extremely. I'm using the blade handle so you guys can actually see what I'm doing, so my fingers are not in the way. A lot of people ask me, you know, you got to dig deeper, right? You got to go in there all the way deep. Take it out. Take out the core. The problem, ladies and gentlemen, is that if you continue to dig and dig and dig, you're going to eventually cut the skin. You're going to break through the skin. Again, this is a symptom of an underlying problem. Fix the problem, symptom disappears. We did give the patient, and a lot of people always ask, well, did you inject anesthesia? Was the patient, was the area numb? I gave the patient the option. The patient said, no, I'd rather defer the local anesthesia. Is it that bad? So? But, I want everyone to know that we didn't give the patient that option. Okay? So, we just have to carefully, just continue to work the periphery. And slowly, this is the part where instead of bad to the bone, bad to the core. The periphery is usually quite soft, all of this. We also recommended a urea-based cream. That will keep everything in check, so to speak. Dr. Weidner, how do you know how deep to go? That's another question I get a lot. You just know, right? You just know. After, doing this for so many years, you just sort of know. So we're just going to continue. This is a massive, ginormous corn. And it's the third metatarsal head. The deeper we go, the softer the skin gets. If anyone is wondering what is that noise, we do have a service dog in the house. Today's segment has been sponsored by Paw Dietary. Get it? The dog, the paw Dietary. You like that one, Caesar? Paw Dietary?
That was almost funny.
Okay. We do have a service dog in the house. Okay, now we're going to start. I'm being very, very careful in this area here. Right, this is actually skin here. So, this is incredible. Talk about a crater. Let's see if we can take a little bit of this out of here. I can feel the bone right there, right here. It's incredible. That should feel tremendously better. Okay, let's go ahead and underneath here, we have two little bones called the sesamoid bones. They play a very critical role in the way that we ambulate, the way that we walk. So the patient is obviously putting a lot of pressure here and here. So we'll go ahead. This one's obviously much better. These are really, great cases. Conservatively, we spoke about a lot of the treatments, including but not limited to, again, using fat, injecting fat, because there is fat pad atrophy. So we try to restore that using either the patient's own fat or fat from what's what we call an allograft. Okay, that's much better there. We have one here on the right. It's basically just all of this callus tissue has caked. Let's go back to this one here, Caesar. Look at it from the side. Just look at that. Unbelievable. Unbelievable. This is the problem here. Let's see if I can carefully. Definitely art at its finest. Okay, ladies and gentlemen, we've made it down to the abyss, all the way down to the trenches. There's no question that the patient is going to feel significantly better, but just like I tell every single patient, this is only a Band-Aid. As the patient already knows and already told me, it's just a matter of time. How quickly are the calluses going to recur? That's why we treat the problem. We don't treat the symptom. And again, like I said before, we're gonna go ahead and make further recommendations. I mean, it's just by looking at it again. Take a look at this. You know, after that, just like I said before, after this, that's it. We break the skin. And I can feel the second, third metatarsal heads. This patient would be an excellent candidate for minimally invasive surgery, as well as the fat pad restoration. Patient is very young. Quality of life, people. Anyways, I'd like to take this opportunity to thank the patient for allowing us to film this segment to educate the world. I'd like to, as always, Caesar, thank you.
You're welcome.
A lot of people still want to know who Caesar is. What does he look like? No, he doesn't. The patient is going, and he doesn't like to be in front of the camera. At least not yet. We will continue to do what we do. We will continue to educate the world one foot and one toe at a time. I'd like to take this opportunity to thank our sponsor, the Paw Dietary Pooch that's here today. Again, for all the non-subscribers, subscribe. Please continue to, I hope you guys are enjoying all of these videos. You know, this is going to be definitely the 2021. We're going to continue to upload some really, really great cases and great videos, of course, as well. Thank you for watching.